allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Quick moment of silence. All right. So, announcements before us. We will announce that the meeting will be recorded. I do not believe we've had any executive sessions since the last meeting.
No, we had an executive session
We had
last Monday.
Personnel related.
So
Yes.
that would have been the 16th?
Okay, and then any correspondence?
No.
Okay, I'll take this time for any public comment. All right, let's move towards the consent agenda. The items on the consent agenda today are the agenda, the minutes of August 11th, the finance report, any proclamations, which would be Fetal Alcohol Spectrum Disorder Awareness Month, National Recovery Month, and National Suicide Prevention Month. So let's start with the minutes of August 11th, the public meeting. Good review them. Can I have a motion to approve those minutes? Or any other?
We can.
Oh, that's right,
We
we don't.
generally do.
That's right. We do, so let's just review and I guess if there are any changes.
Fine with the minutes, they're great, very riveting reading.
All right, and next we'll move on to the finance report. Lisa, would you share that with us?
Sure. On Monday, we had $1,633,265 in all of our funds, $908,324 in the general fund. We borrowed $225 from Roseanne, which is equivalent to what we borrowed last year at this time. We are working actively with all the departments on the budget and expecting their information to come in at the end of the week so we can start getting a preliminary budget together for the budget hearings at the end of September.
Great, so 2022 is almost around the corner here. And proclamations, the first one on our agenda is Fetal Alcohol Spectrum Disorder Awareness Month. Jeff, would you mind reading that one for us?
Sure. September 2021 is Fetal Alcohol Spectrum Disorder Awareness Month. Whereas on behalf of the citizens of Warren County, Pennsylvania, we are pleased to join force Warren Department of Human Services and Beacon Light Behavioral Health Systems Prevention Services in promoting September 2021 as Fetal Alcohol Awareness Month in Warren County. The term fetal alcohol spectrum disorder, FASD, is an umbrella term that describes the range of effects that can occur in a baby whose mother drank alcohol during pregnancy, with fetal alcohol syndrome, FAS, being the most involved condition along the spectrum. Prenatal alcohol exposure is the leading preventable cause of birth defects and intellectual and developmental disabilities. The exact number of people who have FASD is unknown, but it is estimated that up to 1 in 20 school children may have FASD, a rate comparable to autism, and about 40,000 babies are born with effects of prenatal alcohol exposure annually. The lifetime cost for one individual with FAS does not include other FASDs, is estimated to be $2 million, with a combined cost in the United States for FAS alone over $4 billion annually. Many women may not know they are pregnant for the first 4 to 6 weeks, contributing to the late entry into prenatal care and presenting a barrier to optimal pregnancy management, particularly during the crucial early weeks. About half of all pregnancies are unplanned, contributing to late entry into prenatal care and presenting a barrier to optimal pregnancy management, particularly during the crucial early weeks of embryonic development. The good health and well-being of the people of Warren County are enhanced by the support of a national effort to educate about and prevent FASD. Forest Warren Department of Human Services and Beacon Light Behavioral Health Systems join with all residents of Warren County, Pennsylvania, and the many dedicated volunteers, healthcare professionals, educators, and parent groups by participating in this promotion. Now, therefore, we, the Warren County Commissioners, do hereby proclaim the month of September 2021 as Fetal Alcohol Spectrum Disorder Awareness Month in Warren County, and pledge to continue to partner with organizations, healthcare professionals, educators, and the public to raise awareness about our unified message: pregnancy and alcohol don't mix.
Thank you. And the next proclamation we have here before us is National Recovery Month. and I will read that one. Whereas everyday millions of Americans prove the recovery from alcohol and substance use disorders is possible, yet at the same time millions more are struggling with the disease of addiction. Substance use disorders affect all communities nationwide, but with commitment and support, people with these disorders can achieve healthy lifestyles and lead rewarding lives in recovery. By seeking help, people who experience substance abuse disorders can embark on a new path toward improved health and overall wellness. The focus of National Recovery Month this September is to celebrate their journey. Recovery Month spreads the message that prevention works, treatment is effective, and people recover. And whereas this term substance use disorder, commonly known as addiction, is a disease of the brain, and many misconceptions surrounding it have contributed to harmful stigmas that can prevent individuals from seeking the treatment they need. By treating substance use disorders as seriously as other medical conditions, with an emphasis on prevention and treatment, people can recover. And nationally, in 2020, there was an estimated 81,000 Americans who died due to overdoses. The impact of substance use disorders is apparent in our local community. An estimated 85% of our county prison population is made up of persons with charges related to drug and alcohol abuse. A leading reason children are abused and neglected in Warren County is due to their parents' substance abuse. The agency has seen an increase in the number of referrals for investigations involving parental substance abuse. Whereas the Recovery Month observance continues to work to improve the lives of those affected by substance abuse disorders by raising awareness of this disease and educating communities about the prevention, treatment, and recovery resources that are available. For the above reasons, we, the Warren County Board of Commissioners, ask the citizens of Warren County to join us in celebrating and promoting this September as National Recovery Month. Now therefore, we, the Warren County Commissioners, do hereby proclaim the month of September as National Recovery Month in Warren County, Pennsylvania. And we have one more before us, which is the proclamation regarding National Suicide Prevention Month. Seems like there's a theme here. So, would you mind reading that, Jeff?
Sure. National Suicide Prevention Month, September 2021. Whereas suicide is one of the most disruptive and tragic events a family and a community can experience, with an increase of more than 2,000 lives lost in Pennsylvania each year, and an estimated 18 to 25 attempted suicides for each suicide death. In 2020, over 48,000 Americans ages 10 or older died by suicide, making it one of the country's top 10 causes of death. Suicide is the 11th leading cause of all deaths in Pennsylvania, and the second leading cause of death among people from the ages of 10 to 34. National suicide rates have increased significantly since 1999, with nearly every state recording increases of more than 25.4%. Nearly 3 times as many people die by suicide in Pennsylvania annually as by homicide, and Pennsylvania's 2020 suicide rate of 14.89 per 100,000 people being higher than the national average of 14.2 per 100,000. Pennsylvania veterans, active duty military personnel, and National Guardsmen face a disproportionate risk as compared to the general population of Pennsylvania, with more dying from suicide than combat. Public awareness of this terrifying problem is the key to preventing further suffering and loss of life, and the risk for human self-destruction can be reduced through awareness, education, and treatment. And as the highest risk for suicide is among the survivors of those who died by suicide or those who have attempted suicide. Forest Warren Human Services, the Warren County School District, and the Warren County government are committed to working to eliminate the stigma of suicide, educate the community about the warning signs of suicide, and ultimately reduce the rate of suicide in our county. CORE, Choosing Openness Regarding Experiences, is a grassroots organization that collaborates with the Warren County School District and other entities to promote suicide prevention, intervention, and postvention. Now therefore be it resolved that the Warren County Board of Commissioners do hereby proclaim September 2019 as Suicide Prevention Awareness Month in Warren County, and do urge all citizens to work to prevent suicide and to raise awareness and tolerance around all people affected by this tragedy.
Thank you. All right, that's, any other comments or?
Well, I was just going to add that we do have several events in September, because there's so many proclamations related, and there's more that'll be at the beginning of September too, related to these issues. I know that Carrie Swanson has a bunch of stuff she has planned related to core. Also had talked to Ron Tipton and everybody at Human Services about different events that are going to go on during the month. So we'll be sending out a news release on that and have some stuff here, have some stuff there. So really want to try to get the word out as much as possible.
Most definitely, thank you. So could I get a motion to approve the consent agenda?
Make a motion to approve the consent agenda as presented.
Okay, could I get a second?
Second.
Thank you, Ben. Any comments? Questions, okay, motion, did I get, oh, you made the motion, motion carries, sorry.
Oh, we have to vote.
Oh, that's right. Take a vote.
Aye.
Aye. Thanks, sorry about that. There's something else on my mind at the time. Okay, next item, old business. There's a little, the next item on the agenda is old business resolution number 3186, adoption of various GMS policies and procedures. So if you want to turn to that, we see here there is a number of policies and procedures listed as binding, and then others that are authorization given and directed to the chief clerk to work on. And then also others given to the Director of Finance Administrative to write and implement. So I believe that, Ben, you had circulated these policies to the group that we had talked about wanting to see a little in advance. So I guess, is there any discussion on the resolution, comments, a motion to approve it? What's our thoughts here?
So yes, since last week ago, last Wednesday, the vehicle use is no different than what we had previously approved. We're just putting a new number to it. Onboarding employees and filing insurance claims is drafted by HR. Board appointments, that is a new thing we've talked about over the years, but basically codify the process by which we expect organizations that request appointments from us, such as agencies, authorities, and so forth. Pam is the primary draft of that. Polling places, things haven't changed, and then payroll processing hasn't changed. Then everything else may or may not have files that are prepared. But again, we don't want to get into the nitty-gritty of, version control on mileage laws and forms and stuff like that. We just want, the appropriate director of the department to deal with those kinds of things. So for that, I make a motion to approve resolution 3186.
All right,
I'll second that.
okay, motion made and seconded, all in favor?
Oh,
Sorry, go ahead. Discussion.
I just had a couple of questions and stuff. So first of all, I just wanted to state that I went through these with a fine-tooth comb. Didn't want you to think that I wouldn't read them. I thought they were all good. I just had a couple questions about some of the details in them. One was on the onboarding employees section. It references court-related offices and the sheriff's department. And I guess I wanted to ask, were they consulted on that element of it?
Yes, we met with Jeff Arnold, that is connected, and I did, and we met with the sheriff, and then they both came through our training.
Okay.
So yeah.
Have they seen the policy?
Actually, I'm not certain that they have.
That kind of made me a little nervous, I guess.
Is Tim in the room?
No. No, nobody from the courts is here. The meeting is recorded. Just so you know, I'll remember that.
So the sheriff's office would have to follow a policy regardless. I'm not saying we should railroad or anything, I'm just saying that they do. And then the court-related actually can take or not take our policy and procedures as they wish. We can't compel them one way or the other. So I think in terms of process of getting buy-in going forward, I should be making sure that they've seen documents, but from a technical standpoint,
The sheriff's office needs to follow the policy that the commissioners pass, and as much as we might want the courts to have all of us, they don't have to, so this wouldn't be binding on us.
Okay. I was just wondering the line of thinking there, because obviously if they don't or we can't make them, the status quo is the same. The only other thing that because I got a little bit more understanding of the whole form bit, with the idea that the policy is enacted and then the basically these departments they build out the work instructions and the forms that'll be utilized as a derivative of the procedure. The only other thing that I just wanted to say was that when these are presented going forward, if we could just make sure that whatever we're given, that the numbers line up just on the policy numbers, just because there's a lot there and it's difficult to keep track of. And I get that you want to get a draft to us, but just that those numbers are straight. Other than that, and then the only other thing is my understanding is that there's a couple of forms that potentially need to be added to this list of forms. Is the intention to have like a separate resolution for that?
As they're identified, they can be added, yeah.
Okay. All right, those are all the questions that I had about it. Like I said, I went through, made sure everything lined up as far as like the stuff that we were given at the meeting and also the stuff that Pam sent and everything looked good, other than a couple of them. The printed sheet I had, the number on it was different as far as like where it ends in the hierarchy. That's all.
Any other discussions or comments?
I had one or two questions, just real quick. On the board appointments, Commissioner, I think you said that those have to do with basically how proposed nominations are presented to the board. Is it fair to say that that's essentially the core or the singular topic that those policies cover?
Yeah.
Okay. The only other thing, perhaps it's a technicality for the polling place requirements with those, I've reviewed those, I have no concern about the content. I mean, would we vote on those at a Board of Elections meeting?
Yeah, it was on the agenda for the last meeting. We didn't need to have an election meeting, so
That's really good.
I guess that was actually a legal question I had for you.
Okay.
So by bringing this up, are you saying that you would rather have that stricken from this resolution? Well, here's my concern. I would like to have the number I propose approved in this meeting, because it doesn't really make sense to have government management system resolutions separate. But you could maybe make it non-binding until it's been voted on in an election board meeting.
Yeah, I think any formal adoption of policy would happen at a Board of Elections meeting, so however you want to handle it from a technical standpoint is fine, but I would look for a vote at a Board of Elections meeting. I don't believe it's urgent, so whether we have one today or the next regularly scheduled time is no concern to me.
So then we would modify the resolution to exclude the polling place requirements and the polling place policies that are here.
Yep.
Motion to amend as such.
Okay, a second?
I'll second that.
Okay. With that amendment made, let's get a vote. All who are in favor signify by saying yea.
Aye.
Aye.
Okay.
Will be.
Opposed? All right. Motion carries. So, new business. Agreement for Forest County for inmate care for 2022. This is an annual agreement, and I believe that the amount did not change this year compared to prior year, which is $60 per diem for bed space and board. Do I have?
I'll make a motion to adopt the agreement for purchase service with Forest County regarding inmate housing.
Second.
Second, okay. All those in favor, signify by saying aye.
Aye.
Opposed? All right, CYS needs-based plan, financial approval.
The needs-based narrative was brought to you last month. You agreed to sign the narrative. This month, we're bringing you the county match information for you to decide if you're willing to sign off on that so that we can send it to the state. After all of the calculations that we have for year 2022-23, it's $1,055,709.
And that's a decrease of 27,000, I guess.
No, it was 2021. If you look, it is a decrease, because the 21-22 is at 1,083,000.
Okay,
But that note was referring to 2021, which is not really relevant at this point. But you can see that the implementation for 21-22 is 1,083,000. But what was certified in 21-22 is almost the same that we're asking for in 22-23.
okay. All right. Well, we have this before us. Could I get a motion for this needs-based plan financial approval?
I'll make a motion to adopt the needs-based plan, financial plan that's been presented by CYS.
Do I have a second?
Second.
Okay, any discussion? All those in favor, signify by saying aye.
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 Okay. The next item under new business is Emergency Food Assistance Program Renewal. My understanding is that we have this program and that we assign this lead agency of the Salvation Army annually. And that this agreement has been in place for quite some time and it's just a renewal. So I asked if we could get a motion to approve the Emergency Food Assistance Program Renewal.
I'll make a motion to renew the emergency food assistance program
Okay, do I
with
have a-
Salvation Army.
thank you. Do I have a second?
Yep, second.
Okay. Any discussion? All right, all those in favor signify by saying aye.
Aye.
All right, motion carried. The next item on the agenda is an agreement with Lyell Cook, Erie County Coroner. So this is both for 20 and 21. Seems as though we didn't have this agreement. So you'll see in front of you. Excuse me?
I think there was a mix-up as to who is an eligible signer for that, so maybe that missed the 2020 standard agreement. Doesn't look like the rates have increased since 2019. There are simply things that our Warren County Coroner's Office cannot do in terms of autopsies and such, or if we did them, it would be extremely exorbitant in cost to get the equipment and such needed. So we subcontracted to Erie County. Both the district and attorney and the coroner can send things up to Erie County for autopsies. I would move to approve the agreement.
All right, so you make a motion to approve the agreement then? Is that what you said?
Yeah, so
Yep.
just my only question would be, there are two agreements, correct? Because it says we didn't have one for 2020?
Correct, it was mailed to Jerry Borden and Melissa never received it.
Yeah, so I would just make a friendly amendment that it be for the 2021 and 2020 agreements, that's all.
Agreed.
Accepted.
Okay, all right.
I'll second.
A second, okay. All those who are in favor signify by saying aye.
Aye.
Aye. All right, and then lastly is an agreement with CFW to do Act 57 background checks. So that would be an agreement, which is, I believe, annual for Cartography, Ferguson, Wyrick, Weiss, and Gabriel, that we would agree to pay them $275 for each background check. And I believe that this will be entered into August 25th. So do I have a motion to approve the agreement with CFW to do Act 57 background checks for $275 per?
I make a motion to do that.
Okay, second?
Second.
All right, all those in favor?
I just
Any discussion?
I just want
please?
to, for the record, I reviewed the agreement, meets with my approval.
Okay,
Also, the amendments to the Sunshine Act don't actually become effective until August 29th. So there's no concern about,
okay,
adding this to the agenda.
The 24 hour. Well, we had this on, monthly, so
Right.
it wouldn't.
So it was clear anyways.
Yes.
Okay.
great. All right, did we get a second on that?
Yep.
Okay, all those who are in favor, signify by saying aye.
Aye.
Aye. All right, is there anything else to come before the commissioners for new business?
I can't wait until next meeting.
You can't? Well, that's good to hear. Any commissioner comments? No. Motion for adjournment.
Make a motion to adjourn.
Second?